cervical lymph nodes. Now see, the cervical lymph nodes, about 15 to 20% of the lymph nodes are situated in the region of the head neck. 15 to 20% of the lymph nodes are situated in the head and neck. The head and the neck. Classified into two groups, peripheral, outlying the cervical lymph nodes, terminal, deep cervical lymph nodes. Most of the lymph nodes from the head and neck are filtered through the peripheral lymph nodes. All the lymph nodes from head and neck drain directly or indirectly into the deep cervical lymph nodes. So any lesion, any abscess, any trauma, the patient may come with, or any pathological condition will come with lymph node swelling. You please don't ignore it. You start writing medicine. You please palpate. You make the patient sit in a chair and you stand behind him or her and palpate. And draw a small sketch in your prescription pad or your clinical notes and location. Okay? Because you need to give an advice, take an FNAC, fine needle aspiration cytology of the gland. And also you palpate the scalp. If she is a lady having thick hair, then you ask her to locate where the swelling is, where the gland is. Then you just separate your hair and see what is the condition of it. It can be an old traumatic in the head and might lead to a hematoma, and it might be followed by some infection and gives a swelling there. So, now peripheral cervical nodes, the outer circle lymph nodes from pericervical and cervical collar. See the orientation. You just draw sketches. You just draw sketches. See, you draw this. Small sketches. And label it. Okay? See this location. This is in the posterior triangle. Lower jugular chain. And this is a primary tumor below the clavicle. Even if there is a lesion in the stomach, gastric carcinoma, then you might have a gland over here, lymphatic, and you palpate it, that is known as Virchow's gland. Now, outer circle lymph nodes from the pericervical, cervical collar, situated at the junction of the head and neck, cranio-cervical junction, extends from the chin to the occiput, This. Inner circle, lymph nodes surround upper part of the respiratory and alimentary passages. situated deep to the investing layer of deep cervical fascia, deep to inner circle submucosal ring of lymphoid tissue, Waldear's ring. The other day I told you the Waldear's ring and the lymphatic, your nodes and tissues. Now surround the commencement of respiratory and alimentary passages. See, this is the tumor in the thyroid. Cancer cells in lymph nodes close to the thyroid here, blue. Now these are the lymph nodes, green, and this is the trachea. Diagram showing stage N1 thyroid cancer. Now, lymph nodes in the outer circle, again submental, 3 or 4 lymph nodes here, situated below the chin and submental triangle, this part, and submandibular, 3/4 of the lymph nodes situated in the submandibular triangle lie in the contact with submandibular salivary gland. Now, lymph nodes in the outer circle, periauricular lymph nodes here, in front of the periauricular, situated superficial or deep to facial capsule of parotid gland, lie within the gland. Mastoid, posterior auricular lymph nodes, situated superficial to the sternocleidomastoid near its insertion. Occipital, situated at the apex of the posterior triangle along the occipital artery. Now facial, the lymph nodes in the outer circle, facial extension of the submandibular lymph nodes, buccal node, lateral surface of the buccinator, mandibular node at the crossing of lower border of mandible and facial vessels, intraorbital node just below the orbit. Now the facial artery you can palpate. You can palpate, and the labial artery here. The facial artery you can palpate. You palpate your facial artery. You clench or contract the masseter and you will see it. These landmarks you have to know. Now, mandibular node at the crossing of the lower border of the mandible and facial vessels, intraorbital node just below the orbit. Just below the orbit. Now, lymph node in the outer circle, superficial cervical, superficial to the sternocleidomastoid along external jugular vein, extension of the parotid nodes. Anterior cervical, situated along the midline of the neck, along anterior jugular vein, extension of submental nodes. Now, lymph nodes in the inner circle, infrahead nodes lie in front of the thyroid membrane, prelaryngeal nodes lie in the front of the cricothyroid membrane, pretracheal nodes lie in front of the trachea and below isthmus of the thyroid. You can see. What I would say, you draw each section like the PowerPoint. 19 slides are here. You draw each diagram, then 19 pictures will be there. Take it from your book and practice. Now, lymph nodes in the inner circle, paratracheal nodes flank the trachea and esophagus on either side. Paratracheal nodes flank the trachea and esophagus on either side. Retropharyngeal nodes lie posterior to the pharynx and in front of the prevertebral fascia. Now, deep cervical nodes lie along the around internal jugular vein, situated within the carotid sheath and also on the surface, classified as superior group, inferior group. Here, see, this is the carotid triangle. This is the stylohyoid muscle, the styloid process. This is the belly of the digastric muscle. This is the omohyoid muscle, and this is the sternocleidomastoid muscle. Now you can see the lymph nodes in the submental group, submandibular group. These are the two nodes, lymph nodes of the submental, and this is submandibular and deep cervical. The deep cervical, the internal jugular vein, accompanying the internal jugular vein. Now, situated above the omohyoid muscle, chief lymph node, Jugulodigastric node, situated between angle of the mandible and anterior border of sternocleidomastoid, drains lymph node from the palatine, lymph from the palatine tonsils and lymph node of the tonsils. Even you can palpate from the front also. You can palpate the glands from the front. Now, situated in inferior group, situated below the omohyoid muscle, chief lymph node, Jugulo-omohyoid node, situated posterior to the internal jugular vein and deep to sternocleidomastoid, drains lymph primarily from the tongue and lymph node of the tongue. Now, you see any very common lesion, people who are smoking or taking gutka and bimal, all this substance abuse. Now, they come with just, they can't open their mouth like this. Dr. Babu, and you see black stains, foul smelling, oral hygiene is very bad. Then you have to check the tongue if there are any ulcers or your fibrosis of the cheek. That's why they can't open the mouth. And you have to palpate the lymph node, you take a biopsy, a fine needle aspiration cytology, and you can see the drains lymph primarily from the tongue, lymph node of the tongue. Now see deep cervical lymph nodes, this yellow, all this. These are the Jugulo-omohyoid nodes. Now you can see inferior group, lymph nodes situated in supraclavicular fossa, Virchow's lymph nodes. Common site of metastasis for malignant carcinoma of the stomach. Testicular and esophageal cancers are also metastases in these nodes. So where is the testis? If there is a guy who comes with he says the hydrocele, but when you see it, it's hard. Then you have to, you will be taught in the clinics, distinguish between the hydrocele or orchitis or any malignant growth. You do an ultrasound and also request for an FNAC of any suspicious lesion. Another thing is that you have read the descent of testes or undescended testes. Undescended testes. From the kidney level, the kidneys ascend, testes descend. Now, one on the right side that goes to the scrotum, but the left testis cannot be seen or cannot be palpable. Of course, it might be lodged in the external ring, it might be lodged in the inguinal canal or higher up. Then you have to do an operation for orchidopexy and bring it down to the scrotum how much you can, or you place it in the thigh. You make a pocket and put it in the thigh. I followed a child for 5 years. I did an operation of orchidopexy and brought it down up to just below the it is above the cord in the scrotum. Now, why I am telling you that's the case. Another case I saw Molandigi 7 years back. The guy was having an undescended testis. I repeatedly told him that you do an USG, then come. He did not come, but that became a huge tumor, seminoma testis. Now, this case, this boy, or rather boy I would say, above 25, 30, he died. And now, any undescended testis you come across, but that he did not have any Virchow's gland over here, because the earlier you do orchidectomy, remove the testes, then if the lymph nodes are not is not swollen up or in the thing, you will see it in the ultrasound. Also, if you are in your doubt, if you are in doubt, then you do a CT scan. Now, why I am telling you that a man comes over here, you don't meal with a gland here, you feel the stomach, take the history, or he might tell you, Dr. Babu, I am vomiting. What type of vomit color? Coffee ground. Because blood with acid, hydrochloric acid, turns brown. Coffee. Anyone sees it? I told you earlier when I lectured on thorax that hematemesis and hemoptysis. Hematemesis is more dangerous than hemoptysis. You search for glands, everything, but you do a GI endoscopy for gastric carcinoma. And now you see the lymph node situated in the supraclavicular fossa, Virchow's lymph node, and common site of metastasis from the malignant carcinoma of the stomach. Testicular and esophageal cancers also metastasize in these nodes. Actually, there are numerous tools, numerous investigation, numerous blood investigation. But you acquire the clinical knowledge to be very specific and use that tool. Use that tool. This is one point. Now see, Surgical classification of cervical lymph nodes, level 1 submental group. Level 2 is the submandibular group. Level 3 is Jugulodigastric group. Level 4 Jugulo-omohyoid group. And level 5 posterior triangle with supraclavicular group. Yeah. Now, level 6, yeah, anterior midline group. This is sternum. This is clinical anatomy. The radical neck dissection, removal of level 1 to 5 nodes, removal of sternocleidomastoid, internal jugular vein and spinal axillary nerve, modified radical neck dissection, removal of level 1 V nodes, 1 to 5 nodes and sparing other structures, selective neck dissection, removal of some, not all, of level 1 to 5 nodes. Radical neck dissection plus resection of the involved area, commando operation. You precisely, I am telling you, you draw the diagrams. You go on reading. No. You read your text, draw and label. So, two things will be in your memory, and for revision, you use your gadgets. You want illustration, you have that screen in front of you, have your textbook, have your khata. Ekdam burger, Subway burger, you have taken, it's like this. You cannot put it inside the mouth. The Americans, they can put it. They have this